Hello, I'm Dr. Franco, Medical Director of the Arthritis Center of Riverside. One of the diseases that we see, and I have experience with these for over 30 years, are the so-called inflammatory myopathies. These are illnesses that affect the muscles. They produce muscle weakness because they produce destruction of the muscle fibers. In some patients it is mild, in other patients it is quite severe. The normal treatment of these illnesses includes corticosteroids and immunosuppressants. But at the Arthritis Center of Riverside, we use that for a very short period of time, and we also use antibiotics. Some antibiotics, like the tetracycline family, have anti-inflammatory properties, but they also have antimicrobial properties. These patients may also have Mycoplasma infections, because our results, long-term results, are better when we use antibiotics. Speaking of infections, it's important to note that there are some animal models, like the collie dogs, that can develop something which is similar to dermatomyositis. Dermatomyositis, along with polymyositis, are the more frequent forms of inflammatory diseases affecting the muscles and producing weakness. Dermatomyositis will produce loss of hair and muscle destruction. Inflammation first, and microdestruction with loss of function. The collie dogs lose their hair and they become weak as well. Interestingly, they have found that they have Coxsackie viruses, and therefore these viruses produce the inflammatory muscle disease. They get somehow inside the cells of the muscle and produce this damage. It has also been proven in laboratory rats. They have found that laboratory rats with Coxsackie infection, when they sacrificed them, they had destruction of the muscles. So it is quite clear that Coxsackie virus can produce inflammatory myopathies, such as dermatomyositis or its equivalent. In our experience, we have also noticed that some of our patients who get better with antibiotics get better probably because the antibiotics have an antimicrobial property. In other words, they are killing mycoplasmas. So this leads to a new avenue of treatment for inflammatory myopathies, not just the toxic drugs, but other alternative drugs. That is to say, drugs that will promote the well-being of patients. So if we can achieve that in a less toxic way, as I mentioned, I think patients will do better and they will have less disability. And that's what we hope for.